Okay, everybody, welcome back again. And this is again Lynn Hallerman. I am a palliative care doctor, and we are diving into section 3, which is all about constructing an emergency plan with an older adult. Okay, so here's some just big picture things to think about when you're actually talking to a patient about emergency preparedness. The first I would say is to stay very sensitive to where they're coming from in terms of their social and cultural norms, because people, when you're sort of butting into people's, lives in ways that they might not want you to, and it could be about telling them what to do in an emergency. They could say, just, I'll take care of it. It's no worries kind of thing. In my personal life, I can tell you my 82-year-old father-in-law, he does not like us to butt into the way he does things. And we have to approach him in a very polite, sensitive way about getting him to prepare, because he lives alone. He actually lives on an island. So it's just something to think about. You don't want to charge in and just tell people what they need to do in emergency. It probably won't go well. The other thing is, just stay aware of what things really work for somebody, and applaud them for it. If they have strengths in the way they have their networking, tell them that, because that's reinforcing, what they do well, rather than just sort of focusing in on things that aren't working. And then the other thing is, you may need to actively help someone build an emergency kit, and that's something really around education, giving them handouts and checking in with them. Hey, did you remember that, Nick, last time you went to the supermarket, did you get batteries and a flashlight? Things like that. Just, it's something that you can do slowly over time. Okay, so we're back to Mr. G, and just to remind everybody, he is 82 and he's got post-traumatic stress disorder and chronic obstructive pulmonary disease. He lives alone. He doesn't have air conditioning. He lives in an urban kind of setting. He basically can get through his day pretty well, and can use public transportation when he needs it. And he has a social network that works for him, he tells you. But when you look at it, you're thinking that for an emergency, he might need to think about his social network. So the bottom line, in constructing a plan, is there are areas that you are going to be able to help with right away as a medical provider of some sort, whether you're a social worker or a nurse practitioner or someone in administration or a case manager. And some of that is around education, for instance, making sure people don't let themselves run out of their meds. And if you're seeing, that every time they come in for a visit, you're reminding them not to get too close to running out of their meds, so that if an emergency is coming up, they don't find themselves just having 2 pills left in their bottle and they've created a situation. Those are really easy things that you can reinforce all the time that can be very critical for emergency preparedness. Things like, Mr. B, the air conditioning, that we'll talk about more in the second section, but it could be to know where the cooling center is in the community and to give him some information about that. If it gets really hot, that could be life-saving for Mr. G to just even know where that is. Maybe it could be just around the corner. Sometimes buildings with a lot of older adults in them actually have a room, a rec room or community room that actually has air conditioning in it. It'd be good just to find that out. He can ask his super, is there an air conditioning place I can go to in the building? It could be literally life-saving for Mr. G. His social connections, that's something that, in terms of constructing a emergency plan, as a provider in a community health center, you will probably work on that over time. You're not going to be able to solve this in one fell swoop on one visit. But it's sort of gently working with him about who he relies on the most, and you're going to do that sort of over time, is my guess, in a case like this with this kind of patient. Okay, so in terms of cultural norms, it's very common, particularly for older men, and this is a generalization, but you could say it's true, is that they prioritize self-sufficiency and independence, privacy, and they just don't want you involved. There is this issue of creating burden for others that comes up a lot. Patients just don't want to make those calls because they think they're inconveniencing someone else. They just don't want to do it. And it's important to break through that and talk and actually get that out in the open if they're worried that they're creating burden. And if they identify someone that they think they're creating a burden for, to maybe bridge that conversation with that person, like a daughter or so forth, so they can work that out between the two of them. And then sometimes older adults, and again, a generalization, but they do not want neighbors or authorities or anyone else knocking on their door and telling them to do stuff. It's considered intrusive or threatening. Mr. G, he has a history of PTSD. Under emergency conditions, he may react to having police knocking on his door in a different way than someone else. And can you affect that as a provider? Probably not, but at least you can make him aware of that, and talk about it with him. Okay. So how do you start a conversation about emergency preparedness? Always in general, I say with people, start with some open-ended questions and just leave a little bit of space to allow them a little bit of time to respond to an open-ended question, as opposed to sort of doing a checklist with people, which can irritate and agitate people sometimes when you do it that way. Um, so just who ask them, who would you rely on to help you through in a community emergency, like a big storm? Like, see what pops into their head about who that person would be. Um, and then ask them who relies on you. And that's where pets come in particular. Like, are they actually in a caregiver role? Do they live with a partner who actually has higher needs than they do? So there's a good chance of that in this population. So you want to just kind of suss that out, figure out what's going on. You might not have any answers or solutions, but it's just to get people thinking about this. It's actually really helpful just to do that. And then how you wanted to say, is there something that comes to your mind that I can help you to be prepared? See what they say. They may say no doc, no nurse, no case manager, no social worker, there's nothing, but they might, and it might be very helpful, and you could solve something big for them right then and there. So just always ask that question, how can I help support you? Okay, so if you are looking at Mr. G sort of again from a more 30,000-foot view, it usually preparedness falls into these different areas about power supply, transportation, caregiver, communication, medical care. So if you can go down this list in your head as you're asking questions, and it can kind of organize your thoughts about how you want to approach emergency preparedness for a particular patient. So I'm bringing up this issue about electricity dependent equipment because it is. I can't say to you that our health system is really set up to help patients who are dependent this way in emergencies. It really isn't. And when you look at people that died in, like for instance, Hurricane Maria, just so many people were not prepared for the power outages and really suffered, and many died because they had some sort of equipment that they needed and it had no power and there was no planning for it. Very difficult problem to solve on a community level, but at least if you know some of your partnerships in the community to try to pre-plan for someone has a device, that can make all the difference for your individual patient, just having that knowledge and partnering in the community. Power outages can also take other forms. It's not just about equipment. But I know for Sandy, as I was mentioning in one of the earlier sections, we just saw just so many broken bones. I actually looked at some of the deaths in Sandy myself in a document, and so many people were found at the bottom of a basement in a pool of water, face down, dead, trying to deal with electrical stuff. It's very sad and tragic what happened to people after Sandy, particularly in older population. Enormous disruptions for people if you're relying on a caregiver who couldn't get there, people who did not have food and water access, carbon monoxide poisoning. This is so preventable, um, for people to understand they can't turn on their gas stove uh, to get heat. Um, and just a lot of disruptions in medical care. So it can be just I'll say a tsunami after the storm for older adults in particular to deal with all these different components of power outage. So what are the things, that very specifically you can do? And as I mentioned, just making sure they have their medications. It's basic, but it can be the difference between living and dying, about ending up in an ER, all those things. If your health center, it's something to bring up, at a meeting, at your community health center. Do you have a formal way of dealing with this more scaled to the community center as opposed to just your individual patient? Do they have a protocol for that? That would, to me, would be a great intervention to do on a community health center level, in terms of making sure people have their medications. Um, Another basic thing that people just don't have is really just a really clear list of contacts, on a piece of paper in their wallet, um, their medications. This is something, you can do this with a patient during a visit. You can write out their medications for them. I think that's a great thing to do. I've done it. Who their medical providers are, all those things like contact lists. It's just basic. And that's for a provider. This is something right in your bucket to really do well with a patient. And then this issue of call centers, I know there are communities that have these kinds of call center list for a day after a weather emergency or after, um, that's been devised at a level of the community health center. I think that's a great idea, and it can really help you target people that are particularly need an intervention after a storm and sort of deal with that directly. Very effective way to do that. And then there's building an emergency kit, and I suggest that you build one along with your patient. FEMA, they have incredibly good resources for all this. We've been putting them up as the sections have been going on. I highly recommend that you look back and click on the links and look at some of these resources. They're really great. Um, but maybe the thing you can do with your patient really is just going through this checklist and seeing, alerting to them. It's really education that you're doing. You're not going to be going out. You're not going to be the one going to get them their, you're not going to be charging their phone for them. I'm saying. So it's more about education and sort of going through it with them and seeing which things make most sense for them and what they can manage and what some of the resources are for them to build a kit. But it's highly recommended to do that. Okay, documents is another area that you really want to encourage your patients to gather and to have some sort of waterproof, fireproof container. That you can spend a lot of money in that in the form of a big safe, or you can do it really, there's bags, waterproof bags that are much less expensive for your patients to put their documents in. Copies of driver's license, social security card, Medicare card. The disaster alone of not being able to, if you've been displaced and you don't have these things, if you don't have copies of these documents, if you've got, your patient is going to be set up for just enormous amounts of bureaucracy, which can be life-threatening for them to not have some of these documents. So you want to really start encouraging them to put together these documents, copy them, and put them somewhere safely so they don't get ruined. Even things like your rental agreement, your lease agreement, very critical for patients to have, and not to have lost in a flood. Okay, and I'm just going to sort of re-emphasize the importance of having your documents copied and in a safe place. We all should be doing this, but it's just to tell your patients to go over with it. It could be really make the difference for them, and in terms of protecting them from harm or death. This section is really just telling you to try to make an emergency kit, work on that with your patients, do it yourself. Make sure that you're staying sensitive to who they are as a person and their cultural background. And then, store those documents, make sure they're copied. Sounds basic, but it's really what emergency planning is at the patient level. Okay, thank you. See you for the next module.